I don't want to be strong like man who look pretty. I want to be strong like bitch that fight bears in the forest.
Welcome to another episode of Bitch vs. Bear with your hosts, me, Amber, and my bestie, Sydney.
Woohoo!
We are co owners of Shield Maiden Training Co., and this is a show where we bitch, laugh, and chat about all things fitness and wellness related to women and the IA plus community.
Wow, you haven't messed that one up in a
I
while.
know. What's in my head about it?
Yep. You just gotta let it go.
Oh well,
We are in January,
we are
which is crazy.
wild.
So absurd.
Mm-hmm. Yeah.
And I don't know. I think like welcoming everyone to the new year is great. I do think that that is a good thing. And
Okay.
well, okay. So,
But
but yeah, most when you're listening to a podcast or like around this time of year, everyone is like talking about your resolutions or like all your fitness goals and like all the things you're gonna like change about the next year, even though you haven't changed any of those things.
I would be careful with your sarcasm there, lady. That's what we did last year. That was our first episode of 2023.
It was more
Was goals and reflection.
well, yeah, but like okay, so here's my problem with most people when they do that is that they don't actually add the reflection piece.
Ah,
Because like you can't it's really hard to make changes if you're not reflecting back on like the things that are working well for you, the things that aren't working well, and the steps needed to actually make that change. Like if you just write down, I'm gonna be a millionaire. It's like, whoa. Like, well, why are you not a millionaire right now? Oh, because you spend all your money on booze? Okay, so like let's take some steps to figure these things out.
feel
So
attacked.
could be a millionaire, Amber, if only the wine.
Just gotta stop the wine.
Just gotta stop the wine.
I'm just
No,
gonna manifest $1 million.
yeah, there you go. So we are not going to kick off 2024 by talking about how to get a beach bod or
Mhm.
your resolutions or the new hottest fitness trends.
Great. Great.
No, yeah, we're not going to do any of that.
What are we doing?
We are going to talk about the thing that probably most people avoid talking about or doing, and that is going to the doctor.
Bum, bum, bum.
Bum, bum, bum.
Okay.
Because while we talk about health and fitness and all of the other things that you can do to make sure you don't have to go to the doctor very often,
Mhm.
we still have to go to the doctor sometimes. Like most of us at some
Course.
point will have to visit a physician for one reason or another.
Fair enough.
So, we're going to talk about maybe scheduling some regular doctor's visits,
Mhm.
preventative
Mhm.
care, how to do these things.
Mhm. Mhm.
And so I wanted to ease everyone in. We are talking about going to the doctor because I think a lot of people hear that and they shut their brains off. They're like, no, 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 I don't want to do that. I don't like going to the doctor. And they put up even more hurdles. And going to the doctor is already filled with enough hurdles. We don't need to like invent more.
It's true. It's true. Doctor's visits can definitely be one scary.
Yeah. It's like taking your car to get an inspection, right? You're like, it's making a weird noise, but if I just ignore it,
Maybe it'll go away.
I don't when someone diagnoses the problem, then I have to fix it.
Yes, exactly. And we also recognize that there can be a lot of hurdles to overcome when it comes to finding scheduling and visiting the doctor.
Yes, especially for women or well, women one and also members of the LGBTQ just
Hmm.
because they have other things that could be, a hurdle that other people don't face like heterosexuals.
Right.
Just yeah.
Fair. So, choosing the right doctor is an important decision that can have a significant impact on your health and well being. And if you don't currently have a primary care physician or have some things going on where you need to find a new doctor, here are some things to consider when picking a doctor and scheduling your full appointment.
Yeah, cuz I think we as a society, especially in America, really we have started to really emphasize those doc in a box, the
Mm,
like quick doc places where we're like, I just need you to prescribe me this one thing because I'm going to use myself as an example. I'm very allergic now to poison ivy. I know
Mm,
what works for me. I don't go to my primary care. I know that I need prednisone, so I go to a doc in the box
mhm,
and I think a lot of people do that, but that has set a bad precedent for kind of long-term health
mm,
and wellness because you're just like, "Oh, I'm just gonna for lack of a better word, slap a Band-Aid on it," right?
fair. Yeah.
So, yeah. Having a primary is an important thing.
Yeah. I don't know the last time I had a primary care physician. Um, okay. So the first thing you want to do, or one of the things you want to do, is check credentials. Ensure that the doctor you're looking at is board certified in their specialty. This board certification indicates that the doctor has completed the necessary training and actually meets the standards of knowledge and skills in that specific medical specialty.
Yeah, so maybe this, if it's just a primary care that they have their general, if it's something more like if you're if you're like, "Oh, I have a primary care, but I need somebody for my kid." You want to go to a pediatrician. Like it's important that you're getting those credentials checked and that they're actually trained in the thing that you need them for.
What?
Yeah, you probably don't want to go to a neurologist for your foot pain.
For the pain.
So you stepped on a nail. I don't think those things are going to correlate.
Fair enough.
Yeah. So another thing is to make sure that you're reviewing their experience. Look for a doctor with experience in treating your specific kind of health conditions, some of the things that you're working with. Some doctors specialize in certain areas, so it's beneficial to choose ones whose expertise meet your particular needs.
Makes
So
sense.
you're not going to go to your primary care if you're a woman looking for OBGYN needs.
Hmm.
There's a reason that they're specialized, and you can't just unload on your primary care if it's a very, specialized thing that you're dealing with. It is, obviously important for them to record it in your medical records
Yeah.
and or for them to review, but you can also review their experience. So, if
Yeah.
your
Makes
doctor
sense.
suggests a specialty person to you. You don't always have to be like, "Oh, I'm going to take your referral." You can do some due diligence yourself.
Okay. Okay. Um, it's also important to consider referrals. Ask friends, family, or colleagues for recommendations. You can also ask your current healthcare provider, like Sydney was saying, maybe your primary care physician for referrals to specialized care. Um, Personal recommendations can provide valuable insights into a doctor's bedside manner, communication skills, and overall quality of care.
Yeah. I like to think of it as I ask my friends and family for book recommendations, fitness, all of these other things because we have similar thoughts on how, we enter and look at the world.
Mhm.
Why would I not ask them for a recommendation on a doctor?
Makes sense. Yeah.
Yeah, if they enjoy their bedside manner, there's a strong likelihood that I would too.
Yeah, definitely. Especially if they're similar in, kind of demographics or lifestyle. Like if the doctor is not treating your lesbian friend like a human being, they're probably not going to treat you like a human being.
Yeah. And it's also good because then you can ask them for people not only who you would go to, but also people to avoid.
Yeah.
We've all had interactions with healthcare professionals that haven't been the most positive,
Hmm.
and that's important for us to be able to communicate to.
Exactly.
Here's a big one.
Mm.
And this is the one that I would say is the factor for many people when they're first starting because it's such a convoluted and scary place, and that is insurance coverage. So, one, verifying and confirming that the doctor
Mhm.
accepts your health insurance plan, it feels like such a big thing to go through. And
Yeah.
I understand that. It's actually, if you give the office a call, their receptionist can tell you.
Yeah.
And it's unfortunate if they don't take your plan and you're really excited about that doctor, or they've switched and now you have to find a new doctor. That's really rough.
Yeah.
And that does happen,
You
which
gotta
is,
do a lot of cross-referencing between the
yeah,
referrals you got.
exactly. But in the end, verifying that you are covered, then your insurance is good at that facility can save you money, and make sure that you have all of the benefits that
Mhm.
your insurance provides, because there's so many of us who have insurance that don't actually utilize it all the way because
Yep.
one, it's complicated. We don't understand where or how to use it.
Mhm.
And so like making sure that you have a good rapport also with the office is a
Mhm.
great way to make sure that you have access to all of those things, because they can help explain it.
Yep. Good point. So you also want to consider the location of the doctor's office. Is it easily accessible from your home and or workplace? Is it convenient and easy to get to? A convenient location and also convenient office hours can make it much easier for you to schedule and attend your appointments and like actually do it.
Yeah. I
Like
mean,
if it's a pain in the ass to get there,
you're not gonna go.
you're not going. Yeah.
It's like the same reason like when you're looking for a gym or something, there before the pandemic when everybody was, had to drive to work or
Mhm.
get to work in some way, it was always said like pick a gym that's close to your work, not close to your home,
Mm,
because it's
yeah.
always on your way. And I think that's changed a little bit now with the work from home, but it's still kind of like if you are going into an office or going into somewhere to work, pick some place that's on your way. It makes it so
Yeah.
much easier. That's how we pick where we go grocery shopping. Like we
Mhm.
do that just inherently. So if your doctor's office is on the way to your work, you're more likely to go.
And it's so much easier to just say, okay, I'm going to set up an appointment for, X time in the morning so that I can just stop and be, an hour late to work or whatever.
Yeah, or I'm gonna use my lunch break and I'm gonna
Yeah.
go over that. Yeah.
Yeah. Our doctor's office in Maine was within walking distance of our work office. So
Yeah.
yeah, I just scheduled my appointment and then walk over.
Yeah.
It was great.
This one might not be something that most people consider, but I think it's really important is
Mhm.
the communication style. And that's making sure you're paying attention how the doctor and the doctor's office
Mm,
communicates with you.
mhm.
So if you're somebody who only wants to be texted like reminders about when your appointment is and can access everything online, you want to make sure your doctor's office has that
Yes.
capability. Or if you're somebody who wants to call and like have a conversation with a receptionist or an office manager, making sure that that's how that office communicates. Because if you don't, if you can't communicate on those levels, you're going to avoid it because it's an uncomfortable and annoying thing for you.
Yeah. Yeah. That makes sense.
And then diving even more into that, it's important that the doctor that you're seeing listens to your concerns, explains things clearly, and involves you in the decision making about your health.
Hmm.
And that might mean for some of you, you want all of the details.
Yeah.
And for other people, that might mean I want you to tell me the things I need to do. And I don't need any of the in depth stuff,
Right.
because sometimes that just overwhelms people. And it's like, no, I need you to do X, Y, and Z, and you'll be good to go. And people are like, okay, great. That's all I
Yeah.
need. And some people are like, I need to know exactly how this engine works.
Yeah. Yeah. That makes sense. I think that's the problem I had with the doctor I was seeing in the spring is they did not have good communication. They were very efficient when I was there, but that also mean they didn't give me information.
Mm,
And it was a new situation and I didn't know what to ask.
mm,
So I
hmm.
left not having the information I needed,
Yeah.
which was very frustrating.
Yeah.
I'd be finding a new doctor. Um,
Take some of the tips from this
yes,
episode.
I know, right? I'm thinking. Okay, so another thing to think about is hospital affiliation. So if hospital care is a possibility, find out which hospitals the doctor is affiliated with. Now, this is something I hadn't thought of before reading it in preparation for this episode, but it can be really important in case you need to be hospitalized, as you might want to have your doctor
Mhm.
treat you at the hospital, and you need to make sure that they have privileges at that hospital.
Yeah. The most
It's really
common
interesting.
the most common example that I would say is, for, like, gynecological care and
Yeah.
OBGYN, right? Like, if
Hmm.
you're pregnant, you wanna make sure your doctor has privileges at the hospital you're delivering at, so you don't
Yeah.
have somebody
Stranger.
a stranger delivering and doesn't yeah, they have your medical records, but, like, I would say, like, when you're pregnant, you're developing a very intense relationship with your doctor because you're seeing them more frequently than most of us see our doctors.
Yeah.
And so it's a great example of like, yeah, you probably want that person involved when you're delivering your baby.
I mean, I would. Yeah. Want some stranger down there being like, so what's been going on? You should know.
Please tell me you know. Please, please.
Hmm. Hmm.
Um, the office staff. This is one that I think even more than like the doctor itself, but like making sure that you can communicate and have like a good relationship with the office staff.
Hmm.
So, how friendly are they? How efficient are they? They might be so efficient to the detriment of like communicating and providing you details.
Yes.
So, a pleasant and organized office environment can make you feel like more positive about the overall experience. Like if you're
Hmm.
walking into an office and it's super sterile and no one is smiling, you're probably not going to feel super great. But maybe you are. Maybe that's exactly how
Yeah.
you expect your doctors to operate. Is like we want
Yeah.
it clean and we want everybody focused on the thing that they are doing and we don't want any idle talk.
Yeah. I mean, if that's the environment that makes you feel good and not protected, um,
Safe?
safe, cared for,
Yeah.
in a clinical medical setting, great. Go
Yeah.
for it. Um, okay. And so the last point is to trust your instincts. Trust your gut feelings after meeting your doctor or the doctor that you're trialing out. A good doctor patient relationship is built on trust and open communication. So if you feel comfortable with the doctor during your initial consultation, that's a really positive sign. And if you leave that initial consultation feeling like it was not good, then maybe you need to look for someone else.
Yeah. Yeah.
Mhm.
So, okay. Now, hopefully, based on all of that information above, you have selected your doctor.
Okay.
And hopefully, you've scheduled your appointment
Okay.
because that is also a hurdle. Like
It is.
trying to get calendars to line up is a nightmare.
Hmm. Hmm.
The next thing we're going to talk about is how do we actually communicate with our doctor to provide them the most information in a short amount of time?
I don't know how to do that.
Well, we're going to go into it because we know, everybody knows, this is not new information that doctors are people too, and they're trying to do
What?
the most good while working under the constraints of things like insurance companies,
Mm,
hospital protocols, short staffing, and all of the things we know about the medical system.
right.
Okay. So, effective communication with your doctor is crucial for receiving appropriate care and ensuring that your concerns are understood. And we're going to help
Hmm.
you be able to actively do that in what is most likely a 15-minute window.
Right. Yeah. It's a very short window.
It's a very short window. And so we're going to give you some tips to be able to communicate really effectively so you can actually get shit done with your doctor.
Yeah. Okay. So, first, you want to share your symptoms and concerns openly. Your doctor needs accurate information to make an informed diagnosis and provide appropriate treatment. Makes sense, right? Uh, so, you want to be honest with them. Be specific about your symptoms. Describe when they started, how often they occur, and if anything seems to trigger or alleviate them. Include details about intensity and any associated factors you've noticed. Use plain and clear language to describe your symptoms. Don't get fancy. Avoid medical jargon unless you are sure your doctor understands or your doctor or medical professional yourself and you understand what you're saying, or unless it's necessary for accurate communication. Do not, do not Google or WebMD to try and self diagnose and then use your doctor to confirm that conclusion that you came to.
Yes.
That's important.
It is so important because we have access to so much information. There is
Mhm.
no reason for us not to know things nowadays, right?
Right.
But what that means is we have access to information, but not the context in which to use that information
Yeah.
because we don't have the experience as a doctor. We haven't seen all of the things that they've seen. We haven't undergone any of the training that they've undergone. Some
True.
of us have base knowledge, like I would say, like I have a base knowledge of things.
Mhm.
I know like what my, r- heart rate should be. I know what my respiration should be,
Mhm. Mhm.
but that's again like very limited.
Yeah.
And like, yeah, I think we get a little ahead of ourselves nowadays. We're like, okay, yep, it could be a migraine or I have brain cancer. Those are the only 2 options, and your doctor's like, "Might be stress, might be tension,
Let's think about some other
you
things.
might be dehydrated."
Yeah. Uh,
Yeah. Okay, so once you do that and you're talking plainly to them and you haven't WebMD'd too much, because we know we all do it,
yeah.
but don't go in with being like, "I know I have this.
I looked it up.
I looked it up." Yeah, because that's it. Also, when you say, "I looked it up" to your doctor, they immediately are gonna be like, "Ah, this fucker.
Yeah.
Why did I go through
Right.
12 years of schooling for this?" So, if you have specific worries or fears, express them to your doctor.
Mhm.
This can help your doctor address not only the physical aspects of your health, but also the emotional and mental aspects. But prioritize your concerns. If you have multiple symptoms or concerns, make sure that you're prioritizing them based on severity or the impact on your daily life.
Mm.
If your doctor is like, "Hey, how's it going?" And you're like, "Well, my foot hurts and my knee kind of aches. I also got this throbbing headache and I've been bleeding from my ears." Like, let's make sure we're putting the top one at the top of the list there. Like, bleeding from the ears is probably something you might want to address first before you get your big toe aches. Just just
Sure.
yeah.
Yeah.
That's going to help you make sure the critical issue is addressed first.
In that limited time that you have with the doctor.
Exactly.
Yeah. So it's also important to discuss relevant lifestyle factors such as diet, exercise routine, sleep patterns, stress levels. These factors can significantly impact your health, as we know.
Hmm.
So it's important for your doctor to also know those things
Yeah.
about you. Um, it could explain why you're bleeding from the ears. Um, and also, if you're taking any medications, including or maybe especially over the counter drugs and supplements, make sure you tell your doctor because they're not prescribed. So they're probably not on your forms or
Yes.
your chart from past visits. Um, and make sure to mention or reiterate any allergies or adverse reactions that you've experienced.
Exactly. Like one of the things from my own personal that I have learned is it does not affect me in my normal everyday life. I am allergic to blue cheese,
Hmm.
which means I'm allergic to a specific type of mold. I am not a doctor, but my doctor did inform me because I am truly allergic with an anaphylactic reaction to blue cheese. There's a strong likelihood that I'm allergic to penicillin, and I probably should not be given penicillin outside of any kind of medical, like hospital situation where they could give me an EpiPen. So
Hmm.
that's an important thing of like, that's a food allergy that in my normal blue cheese is really super easy to avoid, but it has a direct correlation on medication that I can be given in a hospital and like medical setting.
Hmm. Yeah.
So when it might not seem like a big thing to mention it, well, it probably is.
Yeah. Absolutely.
This one I think gets overlooked. I don't think
Mhm.
people think that they can do this or that they should do this.
I like this one.
I like this one too. You can always bring a friend or a family member if you're nervous or overwhelmed.
Mm.
And it could be really beneficial because they can provide support, they can help you remember important information and hold you accountable and
Hmm.
ask questions you might forget. So, one of the things that I like to think about this is when your doctor's like, "Hey, how's it been going?" Your probable initial response is going to be like,
Yeah.
"Ah, it's fine."
Yeah.
"Well, what brought you in today?" "Well, I'm just here to get a checkup." If you have your spouse or your best friend sitting there being like, hey, remember when you complained about that bleeding from the ear that happened a week ago? And that's why you scheduled this appointment, but you stopped bleeding from the ear. So it's not really a thing that's happening in this moment. That's an important bit.
Yeah.
Like, we have a tendency to really downplay
Mm-hmm.
our symptoms to our doctors, and having friends and family really hold you accountable. It's the
Yeah.
same with going to the gym, right? Like,
Yeah.
it's hard to be like, everything's fine.
And they're over there being like, no,
Mm.
actually. Remember that dramatic shift in your behavior that's happened in the last month?
Yeah. Remember where you stopped being able to feel your feet? I tie your shoes for you.
Yeah.
Yeah. So that's really helpful. And lastly, if you don't feel like your concerns have been adequately addressed, follow up with your doctor.
Mhm.
Schedule another appointment. Talk to the office staff and be like, I feel like I didn't get enough time. So that way you can communicate effectively what's going on. And it might be that your doctor needs more information or
Mm.
clarification on something.
Yeah.
Because as we stated, they're humans too, and they're going to go to the thing that they think is the most likely
Right.
based on the information you provided. And you might walk out of a doctor's visit and be like, shit, I forgot to tell them these three things, which might change how they approach it. And so it's important, if you don't feel like it's been addressed, that you communicate that.
Right.
Because it's really easy for us to be like, oh, well, they're the doctor, they know. And you walk out being like, but I still feel like shit.
Yeah. But do they know?
But do they know? Did you actually tell them all of the important information
Yeah.
and didn't just get like jumbled up in there with,
Right.
telling them everything's fine?
Yeah.
I don't know why I'm here today.
Like I told them about my bleeding ears, but I didn't tell them. I forgot to tell them that I fell down the stairs right before that happened.
And I continuously have throbbing headaches. Like, that's
Yeah.
important information.
And, remember your doctor is there to help you. And this open communication that we're talking about is essential for effective healthcare. If you find it challenging to express your feelings or challenging to remember what you wanted to talk to them about, consider practicing beforehand or jotting down your thoughts to bring with you to the appointment.
Yeah, bringing a notebook can be really helpful.
Hmm.
And I would say one of the things that about like this episode is I recently have I don't enjoy going to the dentist.
No.
I've never really had great dentist experiences. I also have a really unique um feature, I guess, model car. Um and that is I don't have a lot of pain sensation in my mouth. Like, obviously when it's
Hmm.
hot, but like I don't always feel when I have a cavity or things like
Ah,
that other people are like, that tooth is really bothering me. I will be like, I don't really feel anything. And they'll be like, you don't feel that? Are you sure there's a hole in your tooth? And I'm like, oh, really? And like,
that's
I
too
just
bad.
like stick my tongue over there. So it's a unique feature.
Hmm.
While it is nice because I'm not in pain a lot of the time, it's also not great because pain is a sensor that your body uses to tell you something's wrong.
Yes.
And so finding a good dentist has been really hard because of some of these factors and also
Hmm.
just like where we lived. And after diving into this and writing the episode, I was like, oh, I did my due diligence with this new
Hmm.
dentist. I went through these steps and I feel really great about my new dentist. And I've had caught up on like 5 years worth of dental work in like 2 months. It's been a little bit absurd, but I feel so much better having
Mm,
taken care of it.
right.
Still have some work to do. It's okay. I had 2 root canals on opposite sides of my mouth. And my dentist thought it was she was like, you are a rock star. She's like, most people would not do 2 on top and bottom opposite sides. My entire mouth was numb, like
Hmm.
in weird feeling. It was crazy. But I feel so much more confident now. These are not teeth you can see, by the way, either. Like, these are back molars. Nobody can see these, but I feel better knowing that my teeth are in better condition,
Right.
which makes me more willing to do other things for myself.
Hmm.
It's funny how that works.
Funny.
Funny. So, Amber, when are you going to the dentist?
I don't know.
When are you going to find a primary care?
I don't know.
When you find a primary care, can you give it to me?
I thought you were finding a primary care.
Still gotta do
All right, let's wrap this up so we can find primary care doctors.
it. Okay. We're gonna go find primary care doctors based on this. It's gonna be great. We'll let you know how it goes. We're gonna have some appointments. It'll be awesome. We'll recap in like
Such
6
fun.
months. Yeah, right? So it's a hard thing to do to find a doctor that you like. And before we wrap it up, I'm gonna say what always seems to happen is you find a doctor you like and then they retire or they move
Or you move.
or you move. So it's an ongoing process.
Mhm.
And you just have to go in with that mindset of like, this could change at any minute. Have a plan for when that happens.
It's gonna be okay.
It's going to be okay. And you do have to go to the doctor.
Yeah.
You do. Preventative care is the best form of medicine.